As a gerontologist, I have always been concerned about protecting our seniors from germs and viruses. I've always been on the lookout for ways to train staff for 30 years on universal precautions, reducing cross-contamination, and all these other ways that we can protect our seniors. And now this is even more critical than ever before. We need to really protect senior care communities from COVID-19. Older generations of people from around the world and in certain countries like China, Iran, Italy is being devastated, and now Spain appear to have large populations of seniors who are very vulnerable to COVID-19, and the viral infection is causing lots of severe health complications and sometimes even death. So older adults and seniors in the United States are at similar risk, and it is therefore important to do everything possible to protect them. Here's a scope of the problem. There are over 1 million older adults and seniors currently living in skilled nursing centers. I just looked up some numbers today and it was actually 1.3 million. Anything over a million I think is highly significant anyway. And there are around 800,000 older adults and seniors residing in assisted living and other residential care communities around the world. Some of these places are called personal care homes, for instance. And there are questions floating around out there like, would it be better to move some residents back home with their families during the outbreak? Would families be able to provide similar care? And here is an answer that I have discovered. Living at home isn't necessarily the way to prevent the spread of COVID-19, particularly if there are poor hygiene practices taking place there. That's the point. The sanitation, the cleanliness, the use of personal protective equipment, so on and so forth. So here are some precautions in senior care communities that are very important. Many skilled nursing facilities and assisted living communities have decided to maintain limited access to seniors who live there. Some have begun, if not many or most by now, have begun screening employees when they come in for their shift. Visitors and family members are being completely banned from buildings. It's pretty much non-essential. Individuals are banned from visitation right now, except in the case of end-of-life issues and death, near-death situations. So this has taken place due to the Centers for Disease Control and Prevention's warning that people over 80 years of age have the greatest risk for becoming severely ill and potentially dying. So that's important to know. Designated care staff. Here's another good precaution taking place in senior care, and I'm glad this is happening. During this outbreak, many care communities are designating dedicated employees, very specific employees, to care for COVID-19 positive residents, and they are to continually assess the respiratory health of these residents and, of course, others throughout the community. These employees will also lead in training and education efforts, reminding staff every day, holding training sessions on universal precautions and reducing cross-contamination, using personal protective gear appropriately, and then disposing of it after using it so they don't cross-contaminate anyone. Treatment then, this is a good question. Will residents receive in care communities? Currently, as you know, now this might change. This could change tonight or tomorrow or the next day or next week. One thing I keep saying in my updates with you is News is breaking by the hour. Things are changing rapidly. Keep coming back for updates, particularly if you work in senior care. Right now, there are no specific vaccines or medications to fight the virus. But news breaks every day. Perhaps a drug will be revealed. As a matter of fact, I'm doing research on a medication that's being used for malaria. It's being used for rheumatoid arthritis. There's a stronger version. There's a less potent version that seems to be working well in certain studies. I'll save that for another video. Residents who are COVID-19 positive will receive extra fluids and be monitored for dehydration. They will also receive medications to bring down their fever, and they may receive oxygen to help them keep breathing. We want them to do that. Pain medications will also be administered to help with associated aches and pains. Now, some of you may know that care communities are under lockdown. As a matter of fact, every day a new state is saying we're locking down, we're shutting down restaurants, takeout only, drive-through restaurants appear to be doing pretty well. Grocery stores might limit their hours, and now senior care communities are on lockdown across the country. Most healthcare professionals who've worked in senior care for any length of time are used to lockdowns, right? This is nothing out of the ordinary for us. It's not terrifying. These are standard protocol for most skilled nursing facility, and they are actually normally put into place on an annual basis during heavy flu seasons and heavy breakouts of gastrointestinal virus, whatever strain of flu might be occurring during that given year. So healthcare professionals are familiar with this, but the general public might panic or become very, very anxious about the word lockdown in a nursing home. When such a situation arises, many facilities will post signs on the front door, front windows, and this is to communicate to family members and visitors who might be actively experiencing symptoms. Don't come in. Please don't come in. Let the staff take care of those residents. You could check in other ways, FaceTime and Facebook Live and Skype and so on and so forth. Staff are busy inside these care communities cleaning and disinfecting surfaces. They're monitoring their own symptoms such as high temperatures, and they are, very hyper vigilant about spreading viruses within the care community. Here's some final thoughts before I end. Right, it is clearly understood that older adults and seniors are at a very high risk if they contract the virus, that their complications can be very severe and even end in death. While most live at home independently or with some assistance, large numbers of elderly people are in skilled nursing facilities and assisted living communities, other residential places around the country. They do require extra attention, care, and precautionary measures to help reduce the risk of them coming into contact with the virus and becoming seriously ill. I'm Dr. Jim. Please stay tuned for more information as things will be changing rapidly.